Alright, so this video is going to be all about the high hamstring injury, also referred to as proximal hamstring tendonitis, tendinopathy, whatever you want to refer to it as. There is a difference, but for this purpose, we're just going to say high hamstring injury. If you're looking to solve that problem, we got you covered here in today's video. Be sure to stay tuned to the end because we're going to go over a lot of different exercises that you should be using and lay out a specific game plan for what you should be doing in each phase of a rehabilitation process. So, 3 common problems or issues that I see in rehab when people are dealing with a high hamstring issue. Number 1 is make sure you're not confusing it with a different diagnosis. Sometimes SI joint pain actually manifests itself into what can feel like a high hamstring injury. So make sure you know what you're treating first and foremost. If you're treating a hamstring injury, make sure you know it's a hamstring injury. So hamstring injuries generally have a clear mechanism of injury. Usually that revolves around something speed related, volume related, or not written down here, stretching related. So very common in runners who up their speed, whether they're a sprinter or a distance runner. If you're upping your pace, that is a common reason for why you might get injured. If you're upping your volume, common reason why you might get injured. If you're just recreationally running or playing some sport, those are also reasons why you may be injured when you up the speed, intensity, and volume. And then again, stretching, if you're not accustomed to a stretching program, or if you stretch too often from a volume standpoint or go too aggressive, that is another reason why the hamstring injury may occur. But point of this slide is there is usually a mechanism of injury that you can relate it back to, versus the SI joint pain usually is a little bit harder to pinpoint an exact moment of when you started experiencing this pain. Also, from an SI joint pain standpoint, you would be experiencing some sort of back pain with it. The SI joint is generally below the belt line. The facet joint pain can also refer down the leg as well too, but that is generally above the belt line. And generally speaking, back movements make this pain better or worse, versus a hamstring issue is very specific because it's muscular. So anytime you anteriorly pelvic tilt your pelvis, generally you're going to feel an increase in symptoms. When you posteriorly tilt the pelvis, it will feel better, which is the opposite of a slump test, which is a neural tension test to see if you're dealing with any type of SI joint pain or low back radiculopathy. I have seen instances where there is a combination of both, but hamstring issues will never refer pain down your leg. It will always be right at the pinpoint spot of your high hamstring, which is right under the butt fold right here. Now, with a slump test, if you're having a hamstring issue, being up nice and tall, so not rounded will kind of increase the stretch there. But if you think about tilting your pelvis forward into what we call an anterior pelvic tilt, or bring your belly button forward, that's going to increase your hamstring pain, versus if you slouch like a teenager and you kick your leg out straight, generally that feels more comfortable with a hamstring issue. Versus a radiculopathy, it's actually the reverse of that. When you slouch and you kick your leg out, as in pictured here, that's usually more painful for someone dealing with low back pain, radiculopathy, or SI joint pain. So again, different ways of differential diagnosis, but again, make sure if you feel it's a hamstring issue, make sure you're treating the right diagnosis. Second, as I mentioned before, one of the reasons why you can experience hamstring injury is because of an overstretching of an injury. So too much emphasis is often placed on stretching early on in the rehabilitation process from someone who does not know what they are doing. They will tell you to stretch this issue. Contrary to popular belief, stretching actually places a decent amount of tension and strain to the hamstring, especially at that proximal aspect right here. And what it does when you stretch your hamstring, because again, when you bend forward, your pelvis is moving in this direction. And so what happens is the tendon lays down over top of the bony process, your sit bone that you sit on top of, and it creates compression over top of that bone as the hamstring lays down on top of the bone. So it is oftentimes very agitating to stretch a hamstring issue. The tricky part is it actually feels sometimes good in some instances to do it at a moment's notice, because you're changing the sensation around the pain. It's kind of like hitting your thumb with a hammer. You rub it, it feels a little bit better, but you didn't really fix your thumb. The same thing with stretching oftentimes is you're changing the sensation so it feels better in that moment, but then when you stop stretching, it doesn't feel any better. And then if you really track it over the next 24 hours, a lot of times you'll notice that it's actually getting worse when you stretch it. So I would avoid stretching a proximal hamstring issue that is right up underneath the butt cheek on your sit bone that you sit on top of. And along that same theme, you need to be careful of the depth that you go into your RDLs or your deadlifts, because what is that doing? That's stretching the hamstring. You're forward bending again, so there's going to be some compression. So you should not be trying to go to full depth with these RDLs or deadlifts, because a lot of times that's going to be, again, aggravating to the symptoms. Now, this is always person dependent, depending on the level of your symptoms. We eventually want to be doing deadlifts and RDLs at some point in time. So your starting point for everybody is going to be a little bit different. We'll give guidelines a little bit later on in this video. But for someone who is highly sensitive or that tendon is highly hot, we may want to just get rid of these exercises for the time being. It's a great exercise and you should be doing it at some point in time down the road. Your symptoms and the intensity of your symptoms just need to match the intensity of the exercise. So you may instead consider concentric hamstring exercises. These are things such as a seated hamstring curl, a stability ball hamstring curl, something where you're bending your knee and bringing the leg back to you, as opposed to a stiff kneed RDL that your shins move backwards or your hips are hinging a ton. That again can increase the symptoms. This injury is very common for those who are hypermobile, someone who is very flexible. Again, I mentioned overstretching can be a reason why these symptoms start, or increasing the volume of stretching too quickly. So especially for those who are hypermobile, who tend to enjoy stretching because they tend to be good at stretching because they're hypermobile, they have to switch their mindset up a little bit. They need to embrace tightness, because when you get into some of these exercises that we are going to program for it, such as a hamstring curl, such as a glute bridge, such as a hamstring bridge, such as all the different hamstring exercises, you're going to experience muscular tension and muscular soreness. That tension is not bad. The first inclination for those who are hypermobile is, as soon as they get done doing a hamstring exercise, is they just want to stretch it right again. But I just went through this whole entire slide telling you how stretching is irritating to this issue, so you have to resist the urge to want to stretch it. So instead, change your mind frame to, if you feel the need to scratch that itch of stretching, just stretch to move. Don't stretch to actually lengthen and take in the muscle to your end range. So this goes along the lines of stretching. Too much emphasis on eccentric exercises too early on. So this is an RDL here on the left-hand side. This is something that we have to be cautious of. It's a great exercise. You should be doing it. You should be loading it. But a lot of times, I'm going to be starting right at this mid-shin level. I'm just dropping the weight down to just below the knee to reduce the depth, to make it comfortable for people. And if it's not comfortable in that depth, then you should not be doing this exercise, and you should not be doing eccentrics. Likewise, the Nordic hamstring curl, oftentimes called the king of hamstring rehabilitation. Caveat to that is it's a little bit more of a mid-hamstring exercise to a distal hamstring exercise. So it's not really doing too much for your proximal hamstring issue. So I really actually don't emphasize it too much for proximal hamstring issues. But again, that still, because it's a hamstring exercise, still places a decent amount of tension to the hamstring. So it could be an good exercise for you in the long run at some point in time. But early on, the eccentric and the amount of intensity behind the exercise oftentimes causes more problems than it does good. So this just won't be an exercise that you'll actually see me program for a proximal hamstring issue. So 3 solutions to these 3 problems. Number 1 is paying attention to your symptoms. You have to decrease symptom volatility by avoiding aggravating factors. I mentioned that before. What are those aggravating factors? They're usually the cause of the injury, which is either speed or volume related, as far as contraction of the hamstring. Running or playing a sport is one of those concepts, or stretching is a concept. How often are you stretching? What's the intensity that you're stretching at? How frequently are you doing it, or how long are you holding the stretch? Those are all things that could be agitating, and so you have to avoid those aggravating factors. So what I give guidelines for is red light is stopping. So if you're experiencing a symptom increase every time you do the movement, and it gets worse and worse and worse every time you repeat the movement, you should not be doing that movement. That is not helping you out. Green light, no pain at all with the movement. It feels fine during, and then 24 hours goes by, you wake up, and your symptoms do not increase whatsoever. That is a green light. Train that to your heart's content. Be aggressive with that movement. A little more confusing is the middle ground, the yellow light. We actually want to kind of search this out a little bit. This is where you feel just a hint of your symptoms, but it is very reasonable. And every rep you do does not increase the symptoms. The symptoms are plateaued at a very mild level from your baseline. So if you're dealing with 3 out of 10, you really shouldn't go too much more than a 4 out of 10. If you're dealing with a 1 or 2 out of 10, you should not be doing more than like a 3 out of 10 in your discomfort. If your discomfort's at a 7, then we really don't want to increase it beyond a 7. If your symptoms at rest are above a 5, you really should be thinking about cutting out many different things until those symptoms become much less volatile and start getting between the 0 to 3 out of 10 range. So when the symptoms are volatile, as we're trying to work towards 3 to 4 out of 10 in the pain level, again, I mentioned how eccentric exercises can oftentimes be agitating. So prior to eccentric exercises, these are things you may want to consider until the volatility of your pain level starts decreasing and we start getting to a smaller window of 0 to 4 out of 10 in your pain level. So mentioned before, seated hamstring curl. A couple tricks to this. Notice how the person is leaning backwards. That's going to take a lot of pressure off of the proximal hamstring, and that might be a comfortable way for people to start. As you feel comfortable over time, you're actually going to want to sit upright a little bit more. This is going to put a little bit more stretch and strain to that proximal hamstring. So as symptoms allow, you want to be more and more vertical, upright, tall, proud as you do those hamstring curls. But again, depending on the symptoms, start in the reclined position. That's often most comfortable. Second exercise is isometrics. So I like to do isometrics daily or at least 4 to 5 times a week, and holding for, sometimes you got to start at 10 seconds and just start with that. But from a research standpoint, what the research is showing us is that when the body is injured, it's going to use the healthy portion of the tendons first and foremost before it ever starts stimulating the injured portion of the tendons. So that's why isometrics are so valuable, is you have to hold them for a minimum of 30 seconds, upwards of a minute, because what that will do is that will fatigue out some of the non-injured tissue fibers, which will then start stimulating the injured tissue fibers. So that's why isometrics can be so valuable, is it's your window to get into injured portion of tissues, but you have to hold for 30 seconds to a minute, Richter's 𝐸 to start getting into that. It's called the stress shielding effect. So we want to be holding these for 30 seconds to upwards of a minute. Likely if you can hold for 3 sets of a minute and it's comfortable, then you probably need to be upping the aggression. But don't up the aggression so much that you can't hold for at least 30 seconds. So some simple exercises to do that. Ones at home is just pulling your heel up into the bench or into a chair. You get to grade the intensity that you push up, as well as almost think about pushing backwards into the leg too. So you're pushing back this way. So what that does is that will stimulate, you'll feel that right below the butt cheek, right on your sit bone, but you're in control of the intensity. Again, we want to stay within this range, and it should not be escalating on you. It should get more and more comfortable actually. And so you're in control of it. You could also do that with a band looped around the ankle and stand on it with your foot, and you're kicking that heel up as you also are kind of thinking about pushing your leg back behind you. The more you push your leg back behind you, the more you'll actually notice it. These two can be surprisingly uncomfortable for people, so just careful of both of these versions. If these are uncomfortable, generally a donkey kick will be more comfortable, placing the band around the thigh, and again, you're in control of that resistance band, how intense you go, and then you're just holding that position for, again, 30 seconds to a minute. Other versions of exercises are a knee bent bridge. So instead of going up and down, you're just going to pause at the top, and you're just going to hold that at the top position. 2 feet are most comfortable. Single leg is a little bit harder, and generally this is more comfortable than the next one that I'll show you because the knee is bent. So you're going to get a little bit more glute action than hamstring action. It's that hip extension component with the leg straight that is oftentimes irritating for the proximal hamstring. So this is a lot of times comfortable for people, and many people have to start here until they can get to the point in time where a straight leg bridge is comfortable for them. Put the heel up on a couch, an ottoman. You could even do it just on the floor. Your butt's going to barely hover up off the ground. You don't need to go super high with this. The knee is slightly bent. 2 legs, again, is easier than 1 leg, but this would be the ideal version of it. This might be one where you have to start off with a 10-second hold because it is challenging, more challenging than it looks. But again, you want to progress upwards of 30 seconds. It's hard for people to get to a minute with this, but if you can do 3 sets of 30 seconds here, that's pretty darn solid. This is one of those where you are going to feel a ton of tension, and the first inclination for somebody after they get done with this is to want to stretch their hamstring. So again, it's okay to stretch to move, just move around to loosen it up after the exercise, but don't aggressively try to stretch it. You're just going to undo everything that you're working towards when you go to touch your toe and try to stretch it right out after doing this exercise. So resist that urge, stretch, just move the leg to loosen it up, don't stretch it. You will feel a ton of tension with this exercise, but it's a great exercise. It is the gold standard one out of all of these that you want to eventually work towards, especially if you're a somewhat high-level runner. You need to be able to get to this to be able to overcome a proximal hamstring issue, to be able to run at speeds greater than 8-minute mile pace, honestly. If you have that expectation to get back towards it, this has to be in your program, and it has to be a staple, and you need to be very strong with it. So what that looks like in practice, how you program it, isometrics, as I said before, we're trying to do it daily. 4 or 5 times a week is pretty solid. And you're going to do this until you start impact exercises, which we'll get to a little bit later here in the slide. Concentric exercises, such as the hamstring curl type movements, you're going to do 3 times per week. And then as tolerated, you're going to get to the eccentric exercises just 2 to 3 times per week. But the pain has to be below a 4 out of 10 before you start thinking about doing RDLs. It should not be higher than a 4 out of 10 when you're doing those movements, and ideally, honestly, most of the time I like it being below a 3 when you're doing those movements, and it definitely should not be escalating. So in addition to RDLs, there's only 2 eccentric exercises that I'll really do for proximal hamstring issues. One is the RDLs. We already talked about those. Just go down past your knee and then gradually work lower and lower. The second is the hamstring glider. So it's the front leg that you're working here. The back leg is just on a slider, and you want to be holding on to something to keep your balance, because the intent of the exercise is with this heel is you're digging that heel back to pull yourself back upright. So right here, see how his toe lifted up and he's digging his heel back to pull himself back up tall. That's what you're doing to engage your hamstring, and you're keeping that tension as you slide backwards with that movement. I start slower than what he is going here when I'm first starting out, because it's an eccentric, so it should be like a 3 to 4 to 5 second lower on the way back. But as things get more comfortable, this can be a little bit more of a dynamic exercise, and you move somewhat quickly into that stretch position as the video is showing here. Body weight is plenty with this exercise, especially the deeper and deeper you get into the stretch. But again, pain level 4 at a maximum, ideally a 3 and under, and it should not be increasing as you're doing this. It should not cause lingering pain, and you should not wake up 24 hours later and think to yourself, I don't want to do that exercise again. Because if you do that, that means you're probably progressing yourself too quickly through the eccentric phase of things. So start in a shallower range of motion, if that's the case, just like the RDL. Shallower range of motion, work deeper and deeper into a stretch as time goes on and as those symptoms become less and less volatile. And then the final stage, stage 3, this is a must if you are trying to get back to any sort of athletic activity, or again, trying to get beyond an 8-minute mile pace, to be honest, if you're running. So I don't start impact until pain levels at rest are 0 to 1. And when you're doing the exercise, ideally no more than a 3. I do allow some 4s, but again, that pain should be plateaued. It should not be escalating every single rep. And as soon as you stop, the pain must return back down to its baseline, which is that 0 to 1 out of 10. And again, you should be waking up 24 hours later and thinking if you had to do the exercise again, you could, if that's the case. So dynamic movements and impact movements. The simplest dynamic movement is a leg swing. You've all seen this before. It's a great warm-up activity, but you're just swinging the leg back and forth like a pendulum. Start slow. Start through a smaller range of motion, get larger and larger as time goes on. The one we're looking at here is on the right. You could do the cross leg if you want, but it really has nothing to do with proximal hamstring issues. So the one over here on the right, where the leg is slicing forward and backwards, you're going to get a dynamic stretch through that hamstring. Start slow, add speed and velocity as time goes on, both on the kick up and on the slice back down to the ground. Get the body acclimated to moving at faster and faster speeds before we start getting back into a sprinting progression. These next two are much higher level. This one below, you can grade intensity, so it's a nice one to start off with. There's a way you can kind of grade intensity of this one, but this is probably the most intense one of the bunch. So the higher the box, the easier that this gets. So 12 inches is actually pretty hard. If you go all the way up to a 24-inch box, it makes it a little bit easier, but you're trying to switch the legs mid-air so that when that leg comes down, you're dealing with impact as the heel hits the box, and that's getting the shock up through the leg. Why did I tell you need to get super strong with that single leg hamstring bridge? Well, what are you doing now? You're dynamically, violently throwing the leg down to catch yourself in that position. So if you're not strong in that bridge position, how are you ever going to do this exercise? And if you think about running, this is just a running position laying on the ground. If I was to tilt my body 90 degrees and go upright, that's the exact position that I'm striking down into the ground. So that's why these two exercises are so important. If I had to narrow everything down to two exercises, it's good at a single leg bridge, and then add it and make it dynamic. So let's take a look at the exercise again here, switching back and forth. Now you could just gently march the leg back and forth, where you put one leg down and then you switch, and then you just sort of marching back and forth very slowly. That is the starting point. Again, a higher box is easier, but eventually we want to get more and more aggressive, move faster and faster, so that you get more and more impact that the tendon has to absorb. Tendons respond to quick, fast movements, which is why early on I said the reason for proximal hamstring issues is an uptick in speed too quickly than from what you're used to. So what do we do to prevent that from happening again is we prepare it for that. The hamstring bridge shocks is one of the best ways of doing that. I'll do 6 to 10 reps, and I'll do this all on a circuit and then repeat it 3 sets. You're just only going to do this 1 to 2 times a week. The next impact exercise is the hamstring curl shocks. So this one takes a little bit of a setup. If you have a reverse hyper machine, it works great because there's a pendulum here and the weight just kind of swings back and forth. So as that pendulum swings back, you have a cable attached. You can't see it too well, but it's a toe strap attached to the ankle here. So you're going to do a hamstring curl, and then as the weight falls back, it's going to provide a shock or an impact to the hamstring with that curl motion. You could do this in a seated hamstring curl machine, where the weight is going to kind of fling back up and you kind of catch it with your leg, or you stop momentum with your leg. You could do it both seated. Prone, kind of letting that fall and catching it in the leg, is way more aggressive, so be careful if you do it in prone or laying on your stomach. Seated and standing are a lot more comfortable. If you do it in laying on your stomach, you have to be very cautious with the amount of weight and the aggression that you do there, but it is a challenging version of the exercise, and it can be useful too. So you don't actually have to have this pendulum being there either. You could just attach a toe strap or any type of thick nylon band to a squat rack and then just kick the leg backwards, and you're going to get that jolt from when the band, because it's not an elastic band, it's a towing strap, so there is no give to the band, so it's going to give you an abrupt stop, and that abrupt stop is where you get the shock back up through the hamstrings. That's what's going to train the tendons the most, is that shock. Think of the Achilles tendon, the plyometrics that happen when you're jumping rope. That's what you're trying to do with the hamstring exercise here, is get a shock through the tendons. This again, reverse hyper works great. Seated hamstring curl, let the momentum of the weight come back up and then you catch it, or you can again just use a strap and kick back and let the abrupt stop create that shock up through the hamstring. And again, what does that look like in practice? You'll know when you're ready to start these, because the eccentrics should be much more comfortable and should not create any lingering pain. As I mentioned before, your rest pain should be 0 to 10 at this moment, and then pain with exercise should ideally be only a 3 out of 10, nothing escalating, and it should return back down to its baseline level of 0 to 1 very quickly right after you do the exercise. And definitely nothing lingering. You should feel like you could wake up the next day and do it again if you had to, but you're only going to do this 1 or 2 times a week. And then you're going to also add on top of that a progressive sprinting plan. Nothing fancy about this. You're just going to go 40 meters Sorry, that should be meters, not seconds. And then 60 meters, not seconds. You could go yards. You don't need to get specific with this. You don't even have to go 40 or 60 yards. You just need two different lengths, a short length and a longer length. You're going to do 3 of each twice per week. Start at 60%. If you don't feel comfortable going at 60%, you should not be sprinting. Once that gets comfortable, then you go up to 65 or 70. Once that gets comfortable, you go up to 75 or 80. So on and so forth until you eventually get back to 100% effort with your sprint. This is important even for distance runners. Distance runners must do this. I can't emphasize that enough. They think that a sprinting plan is only for sprinters. But distance runners are sometimes the people who deal with the proximal hamstring issue for the longest period of time. The reason behind that is because they have no speed reserve. So if, say, you're running at a 6-minute mile pace, I know there's people that will go faster, I know there's people that will go slower. But if you think about that pace that you run at, if that feels like you're going at 80, 90, even 100% effort of a sprint, that means you have no speed reserve. And let me give you an analogy. If I could only lift 50 pounds up off the ground, if I go to lift a bag of cat litter off the floor, it's going to feel a lot harder. Versus if I can lift 200 pounds off the ground, a bag of cat litter is going to feel like nothing. So that's kind of the same thing with sprinting, is if I can sprint much faster than my race pace, which is a 6-minute mile in this example, if I can sprint a lot faster than that, that means a 6-minute mile is going to feel like nothing on the hamstring. So that's what we're trying to do. We're trying to build in the speed reserve that makes your race pace at a distance feel like nothing because you have a bigger kick to you from what you can do from a sprinting standpoint. So I would argue sprinting is just as, if not more important for endurance runners. Definitely not more important. If you're a sprinter, you have to sprint. But sprinting is just as important for endurance athletes as it is for sprinters or football players or any type of sport field athlete, soccer players. Endurance athletes should be sprinting as well too because of that concept. All right, so that's wrapping up today's session all about proximal hamstring. If you're a rehab clinician or a trainer and you're looking to learn more about these concepts, we have a sports rehab expert certification. We have a treatment process for any and all injuries that you can think of, head to toe. Just head on over to sportsrehabexpert.com. And then we also have a full body treatment assessment domination course as well too. Those are both wrapped into what we call the sports rehab expert certification. If you're an athlete or just active individual who's trying to get over a proximal hamstring issue and you're looking for my help and you want more guidance behind what this video has shown you, we got 2 different options to work with you online. One is just getting a full-blown rehab program that is written out for you in PDF form. You get to follow it yourself. There's no extra help from me. You just get to see the sets, reps, all the exercises that I do it, and you get different phases to the program to lay it out for you. But there's not me there to troubleshoot any questions you may have. It's just strictly the program. Option 2 is more of a custom program. I start with where you're at and then we build it up from there. The workouts are delivered through a training app that I utilize. You get to also send me text questions and send videos for coaching as you're doing the exercise too. So that's the added benefit of going with the custom programming, is you get access to me specifically to ask questions and send videos. What does the pricing look like? That this is always subject to change, but at the time of the video, if you're looking for just the workout, it's $97. If you're looking more of a month-to-month plan with a specific workout every month for you and text, video support, ask questions, that's $145 a month. You can email me, Greg, at sportsrehabexpert.com, and we can get this all set up. And then, or you can visit sportsrehabexpert.com and sign up online too. If you're local to the Ann Arbor, Michigan area and you'd rather work with me in person, then that is fine as well. My local website is annarbor.physio. And you can find me there if you're local to the Ann Arbor, Michigan area. And then additionally, we got one other option too. A lot of times people want to do like an online Zoom session consultation with me. So our sessions are $145 and 30-minute sessions are $95. This can be an add-on to either the PDF workout program or the monthly workout program if you need something a little bit more specific. But again, we already got text support, video support in this one, so less likely that you would need one of these sessions, or at least not as often. As always, if you found this video helpful, be sure to like and subscribe to the channel. Drop a comment down below, a fist bump, a pound, to let us know that you found this video is useful. Feel free to type any questions that you got below in the comments, or suggestions of videos that you'd like to see an in-depth breakout like this in the future of. You help support this channel and make this channel run, so this channel is just as much for you as it is for me, so feel free to keep the discussion going and keep it alive. Appreciate you tuning in. Like, subscribe again, and we look forward to talking with you in the future, either through working together at a course, or working together online through an injury, or just letting you watch the videos here and tune in to all the information that we got for you.